Many people have discussed this condition, commotio cordis, and it certainly is possible. But I think what more important is, regardless of the cause, the key in any type of sudden cardiac event is the rapid response of trained personnel.
That is absolutely true. As we are back with more on the developing story from the NFL today, Buffalo Bills safety Damar Hamlin is still in the intensive care unit in the hospital in critical condition after collapsing Monday night during a game against the Bengals. So many people still have questions about not just what happened with the cardiac arrest on the field, but now what happens with someone like Damar or others who are in this situation as they recover. We don't have specifics for Damar Hamlin, let's be clear about that, but we can learn a lot about this type of situation in general. And for that, we turn to Dr. Stauffer, the Chief Cardiologist at Denver Health. Dr. Stauffer, thanks so much for being here. I'm sure you're very busy talking about this week, as a lot of people have questions. And just beginning very quickly, if people don't know what cardiac arrest is, what's the 10-second version of it?
So cardiac arrest is can be caused from many different things, but generally it all ends with an abnormal heart rhythm that causes the heart muscle to suddenly stop pumping blood, so no vital organs are getting oxygen.
Okay, so in that case, and as we saw right here, it is vital to get some sort of medical professional, CPR, the AED going immediately, right?
That's correct. And it doesn't even have to be a medical professional. Bystander CPR has been shown to improve outcomes after cardiac arrest as well.
All right, we saw on the field that in the case of Damar Hamlin, that was happening easily within a minute or so. In terms of getting blood going again, getting oxygen back through the body, how vital is that to his recovery and to someone's like that who may be in a similar situation?
Yeah, we know from lots of data that for every minute that you delay CPR, your probability of recovery and survival drops by about 10%. If you do CPR, that decrease over time is about 3 to 4% until you hook somebody up to an AED and shock them.
Okay, and it appeared that all happened there. He's in the hospital right now in critical condition. What happens now in terms of the recovery for someone in this situation? I know we don't know specifics about Damar Hamlin's case, but in terms of going forward, how long they spend in the ICU, what kind of treatment do they do, and so forth? Right,
so it's important to recognize that even after you resuscitate somebody, they remain critically ill, and so need to be hospitalized, generally in ICU. The next step is really to look for the cause of the cardiac arrest and to preserve brain function. And if somebody wakes up early, then we don't have to worry as much, and that's associated with a better long-term prognosis and survival. If they have delayed neurologic recovery, so worse brain injury, we actually will cool people down to the low 30s for a couple days to decrease the brain injury and allow them to have better functional recovery.
And I guess it just, it takes time, right? And it's a big shock to the body when something like this happens. It takes a while to recover from, right?
That's right. Frequently, if people don't wake up right away, we will wait until they warm back up after they're cooled, and then wait several days before we can make an accurate assessment of kind of what their prognosis might be.
All right. Thanks so much for the information, Dr. Brian Stauffer from Denver Health. Appreciate it very much.